This is a warning to physicians. You may believe that in a country without socialized healthcare that you, as a physician, have the right to promote medications you believe in and get paid for your advocacy. Other professionals do this all the time. Politicians are even allowed to take money from companies they regulate, and federal authorities are allowed to take jobs from the healthcare companies that they regulate. Why can't you do the same? Because right now, doctors are being targeted and prosecuted to make a political point. I bring your attention to a doctor who operated out of Sandusky, Ohio. This physician was just sentenced to 3.5 years in federal prison, followed by 1 year of home confinement and 3 more of federal supervision. This doctor was prosecuted for receiving $175,000 from Insys Therapeutics, the makers of Subsys. Subsys is a formulation of fentanyl that is a quick and effective treatment for severe pain. Dr. Gregory Gerber, a 58-year-old from Port Clinton, would most likely never have been in trouble for prescribing this medication, except that he was also taking payments for public speaking on the drug's merits. Is this illegal? It's not supposed to be, but when you accept payments like this, it can easily look like you are prescribing more of the medication so the company will keep paying you. Don't do this. Otherwise, the government can tell a jury that you used your practice to prescribe narcotics such as fentanyl, oxycodone, and oxymorphone, which of course every pain practice does. But they will say you prescribed them to patients who did not have a real medical need for them. They will also say that whatever physical examinations you performed were inadequate, that medications were prescribed in excessive doses and for long periods of time. What gives them the right to make these medical judgments? Nothing. In fact, the law says that they cannot, but that won't stop them, because they have the power to ignore the law and pay professional medical witnesses to tell a jury that whatever you did was wrong, that you should have done something else or nothing at all, and that you knew, should have known, or were willfully blind to what the government insists that you should have done. They will also say that you ignored signs of addiction and drug abuse among your patients. Even if you practiced exactly by the book, their medical experts will tell the jury that the book is wrong, and you should have known it. How can you be safe from this type of attack? First, if you treat pain or addiction, get a qualified healthcare specialist law firm to manage your compliance control. Then, if you accept money to speak about a medication, do not prescribe it. If you prescribe a medication, refuse payment to speak about it. Otherwise, they will call you a disgraced doctor who violated your oath to do no harm. They will blame you for the opioid crisis, and with today's opioid panic, they'll convict you. Be smart, stay away from gray areas and so-called safe harbors. No harbor is safe, and get legal advice. Being a caring doctor doing your best to help people will not save you until the opioid inquisition has run its course.